Hello friends, this is Dr Sourabh Patwardhan from Nandadipaya Hospital and FECO Training Center, Sangli, India. And in this video, I'll be speaking about air in the chamber. So it's a regular case, soft grade cataract. I'm doing trench and divide, trying to divide the nucleus into 4 pieces, and then the plan is to remove these quadrants. So as I start going from the trench divide to the quadrant removal, as I increase the vacuum of the machine to aspirate these pieces, what I found is that the air started coming in the anterior chamber. So you can see there is gush of air, first little bubbles, then there is more gush of air there, and I just wanted to see where exactly these bubbles are coming from. So I decided to slow down the video a bit and trying to look for from where exactly it is coming. So it looks as if it's coming from the sleeve, and that's what is expected. So I slowed it further down and trying to see whether giving phaco energy was producing any bubbles or not. And when I slowed it down considerably to 10 times, I found that the first bubble which came out appeared to come from the phaco tip itself, but it was a just tiny bubble. Maybe I might have missed it in the sleeve, but then the rest of the bubbles were definitely coming from the sleeve, which was basically carrying the irrigation from the bottle. And then the gush of air also came out from the sleeve. So I think though the phaco tip oscillations may be a small cause for production of these bubbles, I think the major part of these air bubbles are coming directly from the irrigation, and that is something we should be aware of, and it is something our assistant should watch for when the machine is being primed. So these are disturbing bubbles, though don't affect the surgery, but we may have to again replenish visco in the anterior chamber. So the most probable causes is the entering from the air chamber of the bottle, though few things can be there like trapped in the phaco tip or sleeve. Oscillations and aspiration from the side incision can also occur occasionally. So it is important to prime the phaco tip and sleeve with BSF. Apart from that, we must fill the chamber of the bottle with BSS or the irrigation line, and the irrigation should be started before entering the anterior chamber to avoid any air coming in. So it is important to check the entire irrigation line before we start to avoid this trouble. For more such videos, do watch and subscribe my YouTube channel. Also, you can submit your videos for publishing on our website. Thank you.